Students, today whole world are wearing mask. The whole world is terrified with the coronavirus disease 2019. It is a virus which has the crown shape, and the peoples who are suffering from this virus, the doctor advised to be quarantined or to being isolate. The peoples are not even aware about the terminologies of coronavirus. So I am Miss Aishwarya, and today I bring some light on the terminologies of coronavirus as well as on the symptoms and the safety measures you have to take. So students, the coronavirus, that is COVID-19, is the respiratory disease, and let's begin with to know the symptoms of the coronavirus and the protective measures which we have to take. So the symptoms are fever, cough, shortness of breath, headache, and sore throat. Now let's begin towards the safety measure you have to take. So students, wash your hands in regular interval of time. Stay at home. Wear mask and avoid touching eyes, nose. Clean your household surfaces and cover your mouth when you cough and sneeze. Now students, let's know your risk. If you have no symptoms, then let's see. Either you are self-observation or self-quarantine. Now students, let's know what is self-quarantine means. The terminology of coronavirus, the self-quarantine, the isolation, what does the mean of these words? So, dear students, the people who have been exposed to the new coronavirus and who are at risk for coming down with COVID-19, they are comes under self-quarantine. The health experts, our doctors, recommends that self-quarantine can be last till 14 days. Please students, note it down. The self-quarantine lasts till 14 days. The 2 weeks provides enough time for them to know whether or not they will become ill or be contagious to other people. Now, what self-quarantine involves? The first is using standard hygiene and washing hands frequently. It means during the self-quarantine, the people have to know and has to do the following things. These peoples not share the things like towels and utensils with the other family members and staying at home and not having the visitor. It means the people have not to be visited with the other peoples and staying at least 6 feet away from other people in your household. This is how the person will be self-quarantine. Now students, let's know what is isolation means for people who confirm to have COVID-19. It means when the report of COVID-19 comes positive, the isolation is appropriate. The isolation is a healthcare term. That means keeping people who are infected with a contagious illness away from those who are not infected so that other peoples will be safe. Isolation can take place at home or at hospital or care facility. Special personal protective equipment will be used to care for these patients in healthcare settings. So students, I hope you all are very much aware and well aware from this video about the coronavirus, about the COVID-19, and now you are able to tell others about the term isolation and quarantine. So students, stay safe, stay at home, and fight against corona and utilize your time during this corona time. Thank you.